Welcome back to the show. We are very happy to once again welcome MyCare Medical Group to the show this morning. Of course, they have 15 locations across the Bay Area. They've been providing these services, much needed services, healthcare services to the Bay Area for also more than 15 years now. And this morning, we want to concentrate on seniors and making sure that seniors are getting the care that they deserve, the care that they need, and especially in these times of COVID-19. This morning, we are welcoming Dr. Patel, and also James Debris is back as well with their marketing team. Thank you, gentlemen, for joining us. Good morning.
Good morning. How are you?
Good morning.
Good to see you, James. We're going to talk with you in just a moment, but we're going to start with the doctor this morning.
Certainly.
And again, let's talk about health issues for seniors, because I know we cannot stress it enough how important it is that seniors are keeping these wellness visits and making sure they are staying in contact with their primary physicians. Is that correct? Is that the main messaging this morning, doctor?
Yes. So every patient stay healthy as long as they communicate and see their primary care physician. And to maintain their health requires tailored visit with the physician as well as consultation.
So let's talk about that. I mean, are you having to change how often you see these seniors because of COVID-19? Are you able to see them just as regularly? Like, what should patients expect?
So I keep my clinic open for them, so I see them regularly. But anytime in between, if they have any mental issue other than the physical, like they live alone, they feel depressed, I see them time to time basis, educate them, advise them how to react and like that. So that helps their mentation part as well, and that keep their healthy as physically too.
I think that's so interesting. You brought up seniors, that their mental health as well, just like anybody. I think that is just as important as physical health, is it not? Making sure that everything, is working correctly and making sure they have somebody to talk to about it if it's not.
Exactly. So whenever they have I told my patient, like whenever they feel like they can't focus on their task or daily routine, if they feel anxious, that affect their outbursts, and if they're emotional, they cannot control, or they're feeling hopeless or helpless, I advise them to contact me, and we see them right away. We educate them. We tell them how things are working and what precaution they should take, and stay positive, and that helps a patient a lot.
How important is making sure that you stay in contact with your physician during a pandemic, such as we are going through in these, kind of uncertain times where it feels like health news is changing almost daily?
So I tell my patient that make sure they eat very well, eat a balanced diet, do exercise, focus on the things that they can control. I always tell them to stay in the routine task and maintain it, and always tell them to use the social media to connect with their families and friends, so they don't feel lonely and alone.
Yeah, I want to hear about the response, and I know we're going to bring James here in now too. James, what is the response that you've been hearing from seniors? And I know a big part of what you and your team are doing is making sure that the word is getting out that your team is here and available for them.
Yes. They are very pleased to have someone come by to check on them, first and foremost, because a lot of people have stayed away and not actually engaged with the seniors. And so really our primary mission right now is to reinforce the message of Dr. MK, and that is, don't avoid any symptomology or health concerns that you may have, but because we don't know how long this pandemic and COVID is going to have a grip on us. So we want you to go and see a primary care physician as fast as you can to maintain that good health that you have going for you right now.
Is there a message too for loved ones? I know we have a lot of people here in the Bay Area that are they're caregivers, and their main priority is taking care of seniors as well. What's your message for the caregivers that they can help these seniors make sure they're getting the care they need as well?
Oh, that's an excellent question. There's certain things that even as a caregiver you need to be asking and looking for with your seniors. You need to know when the last time they've seen their primary care physician is. You need to make sure that there's enough food and medication in the home for the senior. You need to look at their sleep habits. Are they having trouble sleeping? Are they feeling anxious? And then really what you want to do as a caregiver is find out what is it that they may need help doing. Because there are a lot of services out there that's available. And as my team goes out, we're asking those questions as well. We're more than just healthcare needs that we provide. We also provide connections to services and other things that we may be able to do. So we're looking to see how we can best help.
And again, doctor, we can't stress it enough. It is a safe place to go. There's no reason why seniors need to put off these wellness care visits. Gentlemen, thank you both so much for your time this morning. Thank you for what you are doing for our seniors here in the Bay Area. And we look forward to seeing you and your team again soon, okay?
Thank you, Carly.
Thank you. All right. We'll, of course, put all that info on our website as well.